tell me a little bit about your nursing background.
I am a registered nurse, went to University of Vermont undergrad, and after that worked at Mount Auburn Hospital in Cambridge, Massachusetts on a medical surgical floor. And then I went back and got my master's and became a clinical nurse specialist, and my specialty is in community health nursing.
Perfect. And then once you, or when did you stop practicing nursing, I guess?
Well, I've always been involved in nursing in some capacity, and that's the great thing about nursing is it's such a flexible field. So after I worked at Mount Auburn Hospital, I worked at an organization called Communities United, and that is, it works with Head Start, which is a population of preschoolers that come from low-income families, and I did all of their health screenings and nutrition, educational sessions for parents, and help them get all of the needed health care, and that was covering 6 towns. And then as my kids grew up, I was doing nursing in the school systems, volunteering to do all of the needed screenings. And now I am what's called a patient navigator, and I accompany senior citizens to medical appointments and help them organize their medications, help them create problem lists and questions for doctors before their medical appointments. And then I take them to their appointments and take notes during the appointment, and then re-explain everything to the client, and then help them with all needed follow-up schedules. So it's kind of combining my nursing background with community service because I do this on a volunteer basis full time.
That's awesome. And when my grandmother was first diagnosed with leukemia, did you agree with the doctors saying that she could wait 12 years to undergo chemo, or did you not really know a lot about the field at that point? And then once she did, the 12 years later, once she started to do chemo, is that when you really started to be involved in the process?
It's a great question. When your grandma first was diagnosed, it really wasn't talked about a lot because it wasn't really a problem until her numbers, her blood work, reached a certain level, and at that point she started to undergo the chemotherapy. And I was involved as much as other people in the family were in terms of being with her during the chemo treatments and helping to support her at home with whatever care she needed. But she was overall very, very independent. And then when there was when the chemotherapy wasn't giving her enough benefit after a few different over the years after the chemo started to lose its benefit with her, and she started to look at other options. That's when I got very, very involved with her, helping her navigate the medical system, also helping to look at the different options and to help explain things to her, and then ultimately to accompany her out to Ohio to meet with who was then kind of the head of the research on the medication that was in a trial that she was considering. And together we went out there and interviewed the doctor extensively to learn about what what was involved with a clinical trial, um, whether um, your grandmother would be an appropriate candidate to be part of the trial, and to understand what some of the risks and some of the benefits and some of the side effects might be.
When she first came to you about this trial, did you think she was absolutely crazy, or did you think it was a good idea to investigate it?
I thought it was a great idea to investigate it, because chemo over time um, loses its benefit, and she was at kind of a crossroads where her her numbers weren't great, and something needed to be done. And so we needed to look at other options. And when this trial was suggested to her by her oncologist at Dana-Farber, um, it's an emerging field. This um, targeted medication for cancer treatment, and it's a new field. It's exciting and something that I felt might hold great hope for her, and I wanted to learn more about it alongside with her.
That's awesome. And when you met Dr. Bird, did you feel you had enough confidence in him to let my grandma be the second person on the first trial that she was told she had to go into for 2 months before getting on to the next one?
We had done a lot of research about Dr. Bird from, um, the internet sites that we could see, and articles that we read that he had published. So of um, I had a lot of confidence looking at his resume and curriculum vitae, and the articles that he had read, and learning a lot about him. So I did have confidence in him. I had also listened to interviews by him that had been posted online, and so I was very excited to meet him, and held, hope that this could, possibly be an answer as to an option of treatment for your grandmother. And um, when we first went out to meet him and found out that she needed to, or he was recommended to be on this bridge trial for a couple of months, um, there it was kind of it was something that we knew that we needed to do, and to trust him that this was the right route to go. We were disappointed that we couldn't be on the trial, that she couldn't be on the trial right away, but we understood that this was a way to at least keep her numbers stabilized enough so that when she was eligible to be in the trial, in the trial that she ultimately was hoping to be on, that this was really the route that we needed to go. And we did have trust in him.
After seeing the success of this trial and seeing the drug become FDA approved, would you say that this is going to be, or targeted therapy is going to be, the next chemotherapy?
I do think that, for your grandmother, it has given her tremendous benefit. And and the great thing too about it is that it has given her a wonderful quality of life along the way. Whereas, oftentimes more routine types of chemotherapy, like the kind that she had received at Dana-Farber, that can often destroy the good cells along with the bad that you're trying to kill. And so it can have devastating side effects. And so it was just fascinating and exciting to see that with this targeted um, treatment, she could um, really maintain a wonderful quality of life, a very active life, doing everything that she loves, and just participating in her hobbies and being with family and traveling and just having a very so-called normal life. And so, yeah, I think that this holds great hope for many, many people, not only with CLL, but with other diagnoses, that this is the future.
That's awesome. Thank you so, so much.